Are you peeing too often, or is your body sending a different warning? The safest first move is not counting trips. It is separating the pattern and choosing the right lane first. Too much urine, sudden urgency, weak emptying, and nighttime waking point to different causes and different next steps. That split can reveal coffee, infection, diabetes, medicine timing, sleep apnea, pregnancy, menopause, or prostate blockage. Most people bring one complaint: I keep going. A clinician listens for separate clues: big volumes, sudden urges, burning, leaking, night waking, and a weak stream do not tell one story. They point to irritation, high sugar, poor sleep, or blockage. Before any test, describe one bathroom trip. Say how much comes out, whether it burns, whether you leak, and whether the stream starts weak. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Urinary frequency means peeing more often than usual. Polyuria means making too much total urine. These terms separate repeated trips from a body producing a large amount. Nocturia means waking from sleep to urinate. Urgency means a sudden need that feels hard to delay. Clear words make the symptom easier to explain. Cause 1 is extra fluid, caffeine, and alcohol. Coffee and tea can stimulate bladder signals. Alcohol can make the body produce more urine. These triggers can change either urgency or total urine amount. Drinking more water is not always healthier. Some people chase extra water and create constant trips. The issue is timing and amount, not proof of better health. Timing tells you more than the cup size alone. If morning coffee creates urgency, the bladder is reacting. If extra water increases trips all day, your body may be clearing fluid. The useful clue is the gap between the drink and the sudden need. Cause 2 is infection or urinary tract irritation. A urinary tract infection, called a UTI, means bacteria irritate the bladder or the tube that carries urine out. Burning, pelvic discomfort, or cloudy urine shifts attention toward irritation or infection. The pattern usually feels urgent and uncomfortable. Infection can cause frequent tiny trips. The bladder may send an urgent signal before it is full. That is why someone may rush to the bathroom and pass only a small amount. Stones and swelling inside the bladder can irritate the urinary tract. A stone is a hard mineral deposit that can scrape the urine passage. That irritation can make each trip feel urgent or painful. If there is no burning, do not stop at irritation. Measure how much comes out. That amount decides whether the next question is bladder irritation or excess urine production. That bridge is where many people guess wrong. Excess urine production can come from fluid, medicine, or blood sugar. A bathroom complaint can hide diabetes before the person thinks about diabetes. Cause 3 is high blood sugar from diabetes, or sometimes from worsening prediabetes. When blood sugar rises high enough, extra sugar can pass into urine. Sugar pulls water with it. That can create large volumes, thirst, fatigue, and weight change. New thirst, blurry vision, weight change, and recurrent yeast infections make testing more important. A urine test may show sugar. Blood testing can show whether high sugar keeps returning. Cause 4 is medication effect. A pill used for blood pressure, swelling, or heart problems may also make you pee more. Water pills, also called diuretics, are designed to increase urination on purpose. Some blood pressure medicines, mood medicines, and caffeine products can also change urine patterns. The clue is a predictable need to urinate after a dose. Late dosing can turn a daytime effect into nighttime waking. Do not stop a prescription because you suspect it. Bring the dose, timing, and symptom pattern to your clinician. Sometimes moving a dose earlier helps. Sometimes the medicine should stay exactly where it is. By this point, the question changes. The most useful clue is not the number of trips. It is whether the trip is large, urgent, weak, painful, or mostly overnight. Cause 5 is overactive bladder. This means the bladder muscle sends urgency signals too easily. It often causes sudden urges, frequent small trips, and sometimes leakage. Basic tests may look normal. Can urgency happen when basic tests look normal? Yes. Caffeine, stress, or pelvic support muscles can trigger the bladder. Those muscles help control leaking and urination. If they tighten when they should relax, urgency can worsen. Constipation can also make the bladder feel full too early. A full bowel can press on the bladder and nearby nerves. That pressure can make the bladder feel urgent before it is actually full. Cause 6 is blockage or incomplete emptying. In men, an enlarged prostate can squeeze the urine channel. A narrowed channel, pressure from nearby organs, or nerve trouble can also leave urine behind. The clues are weak stream, straining, dribbling, and returning soon after peeing. When urine stays behind, the bladder can feel full again quickly. You may not be making too much urine. You may be emptying only part of the bladder. The bladder feels full again because it never fully emptied. Cause 7 is pregnancy, menopause, or pelvic change. Pregnancy can increase urine production and add bladder pressure. After menopause, lower estrogen can make the bladder area drier and easier to irritate. That can contribute to urgency, burning, or dryness. Those pelvic changes usually affect pressure, dryness, or urgency. If trips happen mostly at night, pelvic pressure may not be the whole explanation. Night timing points beyond the pelvis towards sleep quality and leg swelling. Cause 8 is nocturnal polyuria, meaning too much urine is produced at night. Sleep apnea and leg swelling can contribute. Loud snoring, choking during sleep, morning headaches, daytime sleepiness, or evening leg swelling suggest the problem extends beyond the bladder. Sleep apnea can change hormone signals that regulate nighttime urine production. Fluid from swollen legs returns to the bloodstream after lying down. It then reaches the kidneys and becomes urine overnight. Not every nighttime trip begins with a full bladder. Insomnia or disrupted sleep may wake you first, and you may urinate because you are already awake. A bladder diary helps separate waking to urinate from urinating after waking. Repeated nighttime trips can cause fatigue, falls in older adults, and poor daytime focus. Nocturia is more than an inconvenience. A simple bladder diary can make the pattern visible. For 2 or 3 days, record the time, amount passed, urgency, pain, leakage, drinks, urine color, and sleep disruption. That short record can turn a vague symptom into something easier to test. Color, plus the amount you pass, is more useful than color alone. Dark urine with small amounts suggests less water in the urine. Clear urine with constant large volumes suggests too much urine production. Clear urine with small urgent amounts suggests the bladder is sending the urge too soon. Some patterns should be checked sooner. Seek prompt care for fever, one-sided back pain, visible blood, confusion, pregnancy, severe thirst, dehydration, or inability to urinate. Get checked for worsening pain or repeated night waking. Without emergency signs, routine evaluation usually comes next. Urine testing can look for infection, blood, or sugar. Blood tests can check sugar and kidney function. A quick bladder scan can show whether urine remains after you pee. It is the lane your symptom belongs in. Excess production, bladder irritation, poor emptying, or overnight fluid shift. Those lanes lead to different tests and different fixes. Large amounts, small urgent trips, weak flow, and night waking should not be treated as one problem. Name the lane before chasing a solution. Medicine, simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.